It's now time to ask the expert. Back to questions, and we're going to answer them about menopause live on air. Dr. Sonal Haerter with Dignity Health Medical Group. And we just want to make it clear to our viewers that you're offering general guidelines. These are not treatments, so it's always best, of course, for viewers to check with their own doctor. Okay, first off, let's get straight to the questions. Leticia from Phoenix said, when should we start some kind of therapy for menopause, before or when we start feeling the symptoms?
So ideally, when you start feeling the symptoms and the symptoms are disabling you. Now, this can happen before menopause. This can happen in perimenopause, which we know is 10 years, a few months prior to menopause. So I would say, especially hot flashes and night sweats and sleep disorders, mood changes, those are things that you want to address when you have those symptoms.
Okay, let's get to the next one. Kim from Scottsdale says, I had a hysterectomy in December 2019. Hot flashes, weight gain, joint pain, and hair loss began shortly after. I've tried hormone replacement therapy, and that helped with everything except for weight gain. I exercise like crazy and still struggle, and I feel bloated, desperately seeking more help. What do you say?
Tram, this is a common complaint I hear from so many of my women patients. So one of the things that I strongly recommend is weight training, resistance training, especially during menopause, at least 2 or 3 times a week. Okay. And so plus adequate protein intake. So taking some protein, having some healthy nutrition, and weight training along with your other exercise, regime actually works great during menopause. It helps you build muscle, and that actually is a way to maintain your weight, lose weight, but also burn calories.
Yeah, burn that fat. All right. Jose from Phoenix, what is the best treatment to help my wife's hair from falling out so much? And are there any vitamins or anything that can help her with it? That's a good one.
That's a great question. Again, one of the common symptoms in menopause. Now, hair loss can also happen in other metabolic conditions like anemia and thyroid. So definitely make sure that you're checking all those other numbers. But also for menopause, I would say adequate nutrition. I go back to protein again because we don't eat enough protein. I think those are some easy tips for hair loss and menopause.
Okay. Tara from Gilbert says, how do you feel about the new drug? Can you say it for me?
Veoza.
Yes, for hot flashes. I was thinking about testosterone just to make it through my day. How do you feel about that?
So this is such a brand new, and I'm so impressed by Tara because this is a brand new medication and it's on the market for the past 3 months. It's a non-hormonal medication for menopause. What I'm so excited about this medication is because it's non-hormonal, we can use it in certain age groups, especially after 60, and because it doesn't have any hormonal effect, I think we can use it safely in patients with breast cancer or history of heart disease. Now, it's a newer medication, so there's a lot more learning to do, but I do think that it looks very hopeful. It's used for moderate to severe hot flashes.
Yeah, that's promising. All right. Finally, Corey from Phoenix, I heard that menopause can cause hip bursitis. Is this true?
So hip bursitis is basically inflammation of a certain area in your hip joint. And I'm not so sure if it's menopause related, but bursitis is actually caused by overuse or some sort of hip injury. Although I do hear joint pain as one of the common complaints during menopause, but I am not so sure about hip bursitis.
Okay, Sonal, you've been so wonderful. Thank you so much for your
me.
insight and all your knowledge on menopause. All right.